Members of the state legislature have already voted to expand Medicaid under the Affordable Care Act 5 times. Governor LePage vetoed each of those efforts, and there was never enough support among lawmakers to override the chief executive.
That does not help.
One of the Republican legislators who has been holding firm against Medicaid expansion is Representative Heather Siraki. She says previous expansions under Governors King and Baldacci created a financial mess.
It just broke the bank. We ended up owing the hospital $750 million in unpaid, overdue Medicaid welfare bills. We cannot go down that trail again.
Opponents of Question 2 characterize Medicaid expansion as welfare. They say there are affordable private insurance options for low-income Mainers, individuals making less than $17,000 a year. Siraki and others say there are better ways to spend state money on health care.
The disabled must come first. It is absolutely shameful that we have hundreds of people languishing on wait lists for whom the Medicaid program was designed to serve, and they're not being served.
She also says Medicaid expansion is bad for health care providers.
You're taking healthy, able-bodied people out of the private insurance market, and you're funneling them into, forcing them into the Medicaid program with lower reimbursement rates. It doesn't make financial sense.
In Medicaid,
supporters of Question 2 say Medicaid expansion would actually be good for Maine healthcare providers, especially rural hospitals.
A lot of these communities really depend on the hospitals as their primary employer.
Dr. Sam Zager is a physician. He says the bottom line is expanding Medicaid would save lives.
When people have access to care, you can keep people alive, you can keep people functioning and working.
Zager and other proponents of Question 2 say the net economic benefit for Maine would be positive. The federal government would cover at least 90% of the cost of the expansion. Question 2 supporters say essentially Maine would pay in about $50 million for a return worth $500 million.
It's good for the economy, it's good for people's health, and it's good for Maine overall.
31 states, several with Republican governors, have already expanded Medicaid under the Affordable Care Act, increasing health care coverage to about 11 million Americans. Of the 70,000 Mainers who would be covered if the state expanded Medicaid, about 20% are parents. Many do work. Zager rejects the notion that expanding Medicaid for this group of Mainers is welfare.
So if we're going to turn our back on people because there might be some people that somebody doesn't think has worked hard enough, then we're going to turn out a lot of really hardworking Mainers who deserve to have a future.
I'm Paul Merrill, WMTW News 8.